Everyone. My name is Dr. Vijivamula Basker Reddy from Navodaya Medical College Hospital Research Center, Raichur. I did my paper presentation on role of computer tomography in evaluation of paranasal sinuses. First, paranasal sinuses are four paired air-filled cavities surrounding the nasal cavity, usually develop from 25 to 28 weeks of gestation and reaching the adult size by adolescence. They play an important role in hair modification, voice resonance, reduction of skull weight, and immunological defense. And it is superior to MRI in evaluating bony details and fibro-osseous lesions. Aims and objectives. Aims is to evaluate the role of computer tomography in the evaluation of paranasal sinuses. Objectives are: first one is to diagnose the disease of PNS accurately, and second is to correlate the clinical diagnosis with diagnosis obtained by CT imaging, and third is to find out the exact location and extent of the disease, and fourth is to correlate the findings in CT with histopathology whenever possible. And methods is place of studies Navodaya Medical College and Hospital, Raichur. Study design is cross-sectional study, and study duration is 6 months, and sample size is 50. Inclusion criteria is include patients with a suspected or diagnosed sinonasal pathology. Exclusion criteria includes all patients with trauma, patients with a previous history of sinonasal surgery, and pregnant women. Equipment used is GE 16-slice CT. And gender-based distribution. In the gender-based distribution, highest number of patients were in males in this study, accounting of 30 out of 50 people, and it accounts for 60%. Females accounted for 20. This includes 40%. The male to female ratio was 1:5:1. And age-wise distribution in this study, majority patients were in the age of 21 to 30 years, followed by 51 to 50 years. Computed tomography of paranasals were performed on 50 patients in the process, and the diagnostic agreement between clinic and CT fans were calculated. This is the result. Results. The chief complaints includes swelling, pain, nasal obstruction, change in voice, epistaxis, headache, and nasal discharge. Nasal obstruction and headache are the most common complaints here. The CT findings in this study is 27 patients has midline nasal septum, 23 patients had deviate nasal septum with right side deviation seen in 12 patients and left side deviation seen in 11 patients. Conchobulosis was seen in 11 patients. It accounts for 22% with 5 patients having bilateral conchobulosis and 6 patients having unilateral conchobulosis. Osteometal unit was observed is seen in 33 patients. These are the pictorial diagram shown here. The most involved sinus in this is anterior ethmoid sinus followed by maxillary sinus. After the posterior ethmoid sinus and sphenoid sinus, frontal sinus. In this study of 50 patients, 24 patients has bone involvement in the form of erosion, thinning, or destruction. And pattern of involvement includes maximum number of patients has sinonasal polyposis pattern and followed by infundibular pattern. After the sporadic pattern, least common patterns were osteometal unit pattern and sphenoethmoidal recess pattern. And the case gallery includes here the first image shows the axial coronal CT image showing homogeneous soft tissue density lesion extending from antrum to choana on right side with widening of maxillary. And this is the image shown here. And the frontonasal mucocele here, axial sagittal image showing opacification of right frontal sinus with bony expansion. It can be shown here. And nasopharyngeal angiofibroma, axial non-contraction post-contrast CT images showing enhancing mass lesion in the right posterior ethmoid and sphenoid sinus with widening of right pterygopalatine fossa is shown here. And inverted papilloma is shown extending to maxillary with adjacent bone involvement is shown here. And squamous cell carcinoma, axial post-contrast non-contrast CT image showing heterogeneous enhancing soft tissue mass in left maxillary sinus with bony destruction surrounding one side extra sinus extension shown here. And summary includes computer tomography CT and clinical findings of 50 patients with paranasal were evaluated with ages ranging from 9 to 78 years. The most commonly affected age group was 21 to 30 years, and the male to female ratio was 1:5:1. Nasal obstruction, headache were the predominant symptoms in inflammatory lesions, while soft tissue swelling and epistaxis frequently seen in malignant and vascular lesions. And the anterior ethmoid sinus was the most commonly involved sinus, followed by maxillary sinus with both inflammatory and neoplastic lesions affecting the sinus equally. Benign lesions showed sinus expansion with the pressure erosion, whereas malignant lesions demonstrated bone destruction, erosion, and invasion of adjacent tissues. Squamous cell carcinoma was predominantly seen in the older age group. Although CT reliable differentiated benign from malignant disease, histopathology examination was required for definitive diagnosis. Overall CT evaluation proved superior to clinical assessment alone for diagnosis and treatment planning of paranasal sinuses. And conclusion includes, as a conclusion, CT of paranasal enhances the ability to visualize the anatomic structures of the sinus and increase the accuracy of diagnosing paranasal sinus disease. And its value comes from the capacity to identify bony erosion. In order to check areas that are not accessible endoscopy, it is increased utilized in conjugation with endoscopy. It is currently referred to be the gold standing imaging for paranasal sinus pathology because CT is now required for the diagnostic evaluation of paranasal sinus disease and for planning optimal therapy. These are the references I have taken from to do paper presentation. Thank you.